Hello, everybody. Welcome to Pragmatic Lectures. This is a not for profit venture where we prepare free lectures for students who are deprived of classroom lectures during the COVID 19 pandemic. So, we request you to support us by sharing the videos, by subscribing to us, and also by following us on Instagram and Facebook. Thank you. Today, let's begin with a lecture on hepatitis. Hepatitis, as the name suggests, is the inflammation of liver, where hepa means liver and titus is inflammation. Liver, as we all know, is a vital organ that processes nutrients, filters the blood, and also fights infections. However, when it is inflamed or damaged, the functions of a liver can be affected. Hepatitis can occur for a variety of reasons. It could be chronic alcohol abuse, toxins, or even certain medications and medical conditions. But the most commonly associated reason behind occurrence of hepatitis is viral infection. So, depending on the type of virus infecting the person, hepatitis can be classified into five different types. They are hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E. So, talking more in detail about hepatitis A, this is actually a vaccine preventable and communicable disease which is caused by the hepatitis A virus or the HAV. The transmission of hepatitis A virus generally occurs via the fecal oral route or through the consumption of contaminated food or water. Hepatitis A is a self limited disease and it does not result in any kind of a chronic infection. And for the symptoms in adults, it shows like it is characterized by fatigue, low appetite, stomach pain, nausea, and jaundice. However, it is usually resolved within 2 months of infection. Meanwhile, in the case of children less than 6 years of age, hepatitis infection can be asymptomatic or unrecognized. The anti hepatitis A virus antibodies, when they are produced by the immune system, can last for the lifetime and prevent any possible reinfection. The best way to prevent hepatitis A is vaccination. The hepatitis B is caused by the hepatitis B virus or the HBV. This virus can be transmitted when the blood, semen, or any other body fluid of an infected person is made contact or is contacted by a person who is uninfected. And at that time, the virus enters the body of the uninfected person to cause hepatitis B. So, what are the possible ways in which an uninfected person can come in contact with the body fluids of an infected person? They are generally through sexual contact, sharing of needles in the case of you know injections or syringes or other drug injection equipment, or in the case of drug abuse, or also this can be transmitted from mother to baby at the time of birth. Hepatitis B can occur in two forms. It may either be an acute or short term illness, or it may be a long term chronic infection. This risk of chronic infection is generally seen in infants. 90% of the cases reported are seen in infants. Meanwhile, only up to 2 to 6% of chronic infections are reported in adults. Hepatitis B infection is a serious issue, and it can eventually result in liver cirrhosis or also liver cancer. And the best way to prevent hepatitis B is vaccination. Next, moving on to hepatitis C, which is caused by the hepatitis C virus or the HCV, is a blood-borne disease that is caused by or that is transmitted by sharing of needles or other equipment to inject drugs. So the transmission here is similar to how it is done in the case of hepatitis B. However, hepatitis C transmission is purely blood-borne. So the other body fluids like that of semen and mucus cannot transmit hepatitis C. Generally, hepatitis C is a long-term and chronic infection, where about 70 to 85% of the reported cases are long-term and chronic, and rarely short-term illnesses may also occur. And when there is a chronic hepatitis C, there can be health complications that will haunt the individual for a long period of time and maybe eventually result in the death of the person. The main problem with regard to hepatitis C is that it does not have any kind of a clinical illness or it does not show any kind of a clinical illness. At least not until the liver failure occurs or something like that. So, what happens is the person who is infected will not be aware of the infection. Also, adding to this, there is no vaccine for hepatitis C. Thereby, the only best possible way to prevent hepatitis C infection is to avoid the behaviors that can spread the disease. And the behavior here is to stop sharing needles and to have good practices in medical laboratories and hospitals to use sterile equipment. Next, we have the hepatitis D, which is also known as delta hepatitis, and is caused by hepatitis D virus. The hepatitis D infection is usually uncommon. It only occurs in people who are infected with hepatitis B virus. That is because the hepatitis D virus is an incomplete virus and it requires the helper function of the hepatitis B virus in order to replicate. Here again, this can be a short term and acute infection or a long term chronic infection. And the transmission generally is through the percutaneous or mucosal contact with infectious blood. Also, additionally, this might occur as a co-infection with the hepatitis B virus or as a super infection in those people who already have a hepatitis B infection. So far, there is no vaccine available for hepatitis D, but however, it can be prevented by hepatitis B vaccination if the person is not already infected with hepatitis B virus. At number 5, we have the hepatitis E infection, which is caused by the hepatitis E virus or the HEV. This infection is a self limited disease and it does not result in anything chronic or long term. Hepatitis E is like very common across the world, but it can be rarely found in developed countries like USA. And the transmission of this virus plays a crucial role in how it is endemic to the developing or underdeveloped countries because it is transmitted through the ingestion of fecal matter. Even very small amounts, microscopic amounts of fecal matter ingestion can cause hepatitis E. And such mode of transmission or success of such mode of transmission is usually associated with contaminated water supply and poor sanitation. So far, there is no FDA approved vaccine for hepatitis E infection. Now, talking about the symptoms of hepatitis, in most of the cases, the symptoms are mild or asymptomatic, so there are no symptoms at all. However, if there are symptoms to appear, it can occur anytime within 15 to 180 days after infection. And this applies to all the types of hepatitis. In an event of acute hepatitis, where the infection is short term, or if the infection is long term, the initial phase of this infection is regarded an acute phase, and the symptoms during this phase is similar to mild flu, and it includes characters such as diarrhea, fatigue, loss of appetite, mild fever, muscle or joint aches, slight abdominal pain, vomiting, weight loss, jaundice, and nausea. Generally, this acute phase is not a dangerous phase, but it can still result in acute liver failure or death that is associated with the failure of liver. Also, an acute phase can eventually progress into a chronic infection, which is most likely to occur in the case of HBV and HCV infection. So, when we move on to the chronic hepatitis, which is generally followed for which generally follows the acute hepatitis, this stage or this phase is characterized by progressive liver failure, and such a liver failure results in jaundice, swelling of the lower extremities, confusion, and also excretion of blood in feces or by vomit. Additionally, there can be occurrence of dark urine, hives, itchy skin, light colored feces, and yellow skin, white or yellow eyes, yellow regions of the eye whites and the tongue, which are also the symptoms of jaundice. Notwithstanding, there is another glitch here. The chronic hepatitis may not be detected until liver failure. This is the main problem associated with chronic hepatitis. Thank you all for your interest. Kindly like the video and drop your comments on what the lectures you want to listen to, and also do subscribe to our channel. Thank you.